It's the start of Mental Health Awareness Week, and the theme is nature. And new research has shown that 1 in 5 adults have experienced depression in the first 3 months of this year. That's more than double pre-pandemic levels.
And while the government pledges millions of pounds to support children's mental health in schools, will it be enough? We're joined now by the Health Minister, Nadine Dorries. Very good morning to you, Nadine Dorries. I just want to start firstly with something that actually has impacted mental health, and that's the not having the ability to hug our loved ones. Is the Prime Minister going to confirm today that he is going to make hugging legal again? I mean, it seems remarkable that we're in this situation. We spoke to an epidemiologist a little bit earlier on the programme who said if you are driven by the science, if you're driven by the data, you should reconsider allowing people to have that sort of contact.
Is she there?
Can you hear me, Nadine?
Sorry. Oh, sorry. Was that a question? Right, yes.
Yes.
So, sorry, I thought I'd lost you.
OK. Well, I'm sorry if I lost you, but is the government going to confirm that we can hug again in the light of an epidemiologist saying that you should reconsider?
So you listened to the Prime Minister this afternoon at the press briefing where he will outline the next steps along the roadmap to recovery. It's important, I think, to keep in context that we are, as a country, leading the world in COVID recovery. And therefore, whilst being optimistic, we also have to exercise caution. And so, yes, it's absolutely right that we are following the data, but we do have variants of concern. But we also have in our armoury the capacity for surge testing and the ability to provide those people, anyone who needs it, 2 lateral flow tests a week to test. So we have that in our armoury against the variants of concern. Whilst moving forward on the roadmap, we also have to be careful that as we ease, that the data doesn't increase, that the variant doesn't, that the virus doesn't become more transmissible. And so, and the figures don't increase. So that's the important thing. It's optimism with caution. And I understand, the comments that people have made about on one side of the argument and the other, but we are very aware. We are following the science, following the data, as we always have. We're being cautious and optimistic and following the roadmap as it's been laid out. You will hear more about that this afternoon. Yeah.
Nadine, you talked about the Prime Minister doing a briefing later on. Back in March, he did a briefing. He was asked by a member of the public, I think she was from Glasgow, Hannah, where she talked about the impact of the pandemic on people's mental health. And he committed to a mental health spokesperson, presumably, possibly yourself or Alex George, to being at one of those briefings to talk about the government's approach to mental health during the pandemic. And that has never happened. And I think the mental health community feels actually that mental health has not been a priority during this pandemic.
Well, I think mental health has been raised a number of times at the press briefings, and it has been an absolute priority. We were allocated £500 million during the spending review for the COVID recovery plan, which has been in place. That was on top of £2.3 billion per year, which has been allocated, on top of the funding that we pumped into schools last September, and we've just announced today is going into schools this week. Mental health has been a priority. And Alastair, we know the 2 groups which have been affected during the pandemic. And those are people with pre-existing mental illness, such as schizophrenia, psychosis, and the other long-term clinical depression and the other illnesses. But we know the other groups as well, and they are particularly young women aged 15 to 26, and particularly those with eating disorders. No mental health service closed during the pandemic. All services remained open, and not only that, we increased services.
We've launched more. Nadine, if those figures from the ONS last week are borne out, then we're going to need an awful lot more. And I also want to know, the £70 million that you're announcing today, is that part of the 79 million that was announced in March as part of the COVID recovery group, which in turn was part of the money announced in the spending review? So I do get the feeling you're kind of re-announcing money here.
No, we're not re-announcing money. What we're doing is money has not been allocated. This money has been allocated directly to 7,800 schools in order to put mental health leads in place, to provide training and support for those mental health leads, to support children and the mental health support teams which we've put into school. You know, we did hope to have 25% of school covered by 2023. We now have increase that to 35% of schools by 2023. And you know, those teams, do not underestimate the ability of those teams to spot mental health problems in children at a very early stage and to nip those in the bud, because we know that when children present early with mental health issues such as eating disorders, which have the highest mortality rate, that we can prevent those early signs becoming much more serious mental health issues and illnesses later on in life. So they're vitally important. And you know, Alastair, years ago, mental health was not a place where people really wanted to work. We are taking advantage of the fact that we now have an increased number of people who want to work in mental health, people going on postgraduate courses that we're running at universities.
Okay.
So we can get people through the system and into the schools, working with young children through those health support teams.
The Children's Commissioner's report into the state of children's mental health services in England, published in January this year, said last year only 20% of children referred to services, mental health services, started treatment within 4 weeks. If getting there quickly is the priority, how come we're not getting there quickly enough with enough children?
Well, we're getting there quicker all the time. And, you know, one of the interesting things, the pandemic in its own way has acted as a catalyst. And one thing that we have learned from the pandemic is that children and young people, and I've spoken to them myself through Barnardo's and other organisations, are demanding their services are delivered to them in a very different way. They are saying to us, we don't want to be taken to a hospital or an institution to sit in a waiting room and wait to see a counsellor or a psychologist. We don't want that. We want our mental health services delivered to us via our phones and via our laptops and our tablets. And we are developing services to be able to do that for children, to be able to get, and some of them are. And one of the things that we have learned is that if you can
replace face-to-face contact, Nadine. You know that. You'll never replace the benefit of face-to-face contact.
Absolutely, Alastair. And there are those people who need that one-to-one service, and that will always be there. And those people will wear appropriate.
But at the moment, how can you explain the fact that 1 in 5 children referred to services, only that small proportion of children get that treatment within a month? I mean, presumably the other 80% don't want that help on a tablet or on a phone. They need that help urgently.
So we are shortening the waiting times to get young children and young people to have help, to have those face-to-face contacts. And IAPs are increasing. As I just said, we're developing services to get to children and young people quicker, because we know that's how they want it and that's how they want their services delivered. But what we are doing with the funding, huge amounts of funding that we are putting into mental health, workforce has always been an issue. Having the people to deliver mental health services to children and young people. There has always been a shortage of that workforce, of trained mental health nurses, of trained counsellors and people trained to work in schools. Those people are now coming through the system. The money has been allocated for the workforce. People want to work in mental health. Alastair, that's partly down to you. That's partly down to people who've highlighted the issues over recent years of mental health. We now have people who are interested in working with children and young people. As that workforce comes through, we are getting them into schools as fast as we can. We're getting them in front of people who need those mental health services. The more that shorter the waiting times can be.
Thank you very, very much for coming on. I did have a little fear yesterday that there might not be a Tory minister on today, but there you are. Thank you for that. Look after your own mental health, and let's please work towards genuine parity between physical and mental health, because that's what we're going to need long term. Thanks, Nadine.
We're getting there.
Thank you.
Thanks.